Hello, welcome to another video. So in the last video we treated nephrolithiasis, which is the formation of kidney stones, and today we are going to be looking at another lithiasis. So today we'll be looking at urethrorithiasis, and basically, as the name implies, urethrorithiasis refers to the presence of one or more stones, particularly in the urethra. What is the urethra? The urethra is a muscular tube that carries urine from the kidney to the bladder. So urethrorithiasis is when there are stones in the urethra. So it is a subtype of another condition known as urolithiasis, and it most commonly results from the migration of renal stones. So urethral stones, they can cause acute symptoms such as severe flank pain, hematuria, and obstruction of urine flow. So let's look at the background of this condition. So urethral stones are most commonly composed of calcium oxalate or calcium phosphate, and they affect both sexes, male and female, although they are more common in males. So even the nephrolithiasis we talked about in the other video, it was also stated that it's more common in males, but cholelithiasis is more common in females. So urethrorithiasis is a major cause of emergency department visits due to the sudden and severe pain, and stone passage depends on the size, the location, and the degree of the urethral spasm. So looking at the causes, what exactly causes this urethrorithiasis? So same as nephrolithiasis, dehydration, because dehydration leads to concentrated urine, and then high intake of oxalate rich foods like animal protein or sodium. Then some metabolic disorders like hypercalciuria, hyperoxaluria, hyperuricosuria, then some UTI infections caused by urease producing organisms like Proteus and Klebsiella. Then some genetic disorders like cystinuria, and then anatomical abnormalities of the urinary tract is also a cause. So the symptoms that we see in this condition, there will be a sudden onset of sharp cramping flank pain, often radiating to the lower abdomen or the groin, and then there will be blood in the urine, nausea and vomiting, almost the same symptoms like you see in nephrolithiasis. Then there will also be pain during urination, urinary urgency or frequency, and possible fever if an infection is present. So looking at the anatomy of the urethra, so like I said before, the urethra is a muscular tube approximately 25 to 30 centimeters long that transports urine from the renal pelvis to the bladder. So it is divided into three parts: the upper, the middle, and the lower urethra. So stones can obstruct the lumen at common narrowing points known as the uretero-pelvic junction, crossing over the iliac vessels, and the ureterovascular junction, causing back pressure and intense pain. So for the pathophysiology, so there will be supersaturation of urine with stone forming substances. Then the stone formation will occur in the kidney. That is where we have nephrolithiasis. So nephrolithiasis will occur first before we have urethrorithiasis. So they are basically connected. So there will be migration of this stone formed in the kidney into the urethra, causing mechanical obstruction. Then there will be increased intraluminal pressure proximal to the obstruction. There will be urethral spasm and urethral inflammation. Then possible urinary stasis and infection if this condition is left untreated. So let's look at the differential diagnosis. So other conditions that could mirror the same symptoms like we see in urethrolithiasis. So for example, renal colic due to nephrolithiasis. So there will be similar presentation with flank pain, hematuria and nausea, and the stones they remain in the renal pelvis or the calyces, rather than descending into the urethra. So even in cases of acute appendicitis too, where there's like the pain starts around the umbilicus and it migrates to the right lower quadrant, so it may be associated with anorexia, fever, and rebound tenderness. Then in another condition like ectopic pregnancy too, we could see similar symptoms, where there will be lower abdominal pain, vaginal bleeding, and is often confused with pelvic or abdominal causes of pain. So besides all these conditions, even in cases of pelvic inflammatory disease, where there is a bilateral lower abdominal pain, there is fever, there is tenderness. So all these symptoms, we also see it in cases of this urethrolithiasis. Then even in pyelonephritis that is caused due to infections in the kidney, there will also be the flank pain and other various symptoms too. Then how is urethrolithiasis diagnosed? Similar to how nephrolithiasis is diagnosed. So there will be urinalysis, which will show presence of red blood cells, white blood cells, and crystals. Then it can be diagnosed with the gold standard way of diagnosing, using non-contrast spiral CT scan, and is especially good for detecting radiolucent uric acid stones. Then ultrasound too, which is preferred in pregnancy or where radiation is contraindicated. Then X-ray for radiopaque stones. And yeah, that is basically the diagnosis, similar to how they diagnose nephrolithiasis. Then for the treatment too is kind of similar. So for the acute symptom relief that we see in this condition, so for the pain management, diclofenac sodium 75 milligrams intramuscularly, then 50 milligrams orally every 8 hours. And then if NSAIDs are contraindicated, we can give morphine or we can give petidine. And then we give fluids, try to hydrate the patient. And if the patient cannot take water orally, we try to give intravenous normal saline 0.9% sodium chloride. And then antiemetics too, to control the nausea and the vomiting, metoclopramide or ondansetron, and alpha blockers like tamsulosin, which is given orally for up to 6 weeks to help facilitate the passage of the distal urethral stones, which are less than 10 millimeters in size. So it's for smaller stones, it can work in this case. And then there's something called medical expulsive therapy. So is indicated for stones less than 10 millimeters, especially stones that are in the distal urethra, and it includes this tamsulosin, so alpha blockers, and it also involves giving the patient adequate like water to keep them hydrated, and also giving them medications for pain management too. So looking at stone specific management, so if the patient has calcium stones, like stones that are caused by the accumulation of calcium. So we advise on low oxalate diets, and we prescribe thiazide diuretics, hydrochlorothiazide to be specific, and then we can give potassium citrate to increase citrate excretion. And if the stones are caused by uric acid, we can prescribe potassium citrate for the alkalinization of the urine, and allopurinol daily if there is hyperuricemia. Then for struvite stones that come due to like infection from urease producing bacteria like Proteus, so it usually requires antibiotics like ciprofloxacin or amoxiclav, and often with surgical removal too, because these stones are usually very big. Then cystine stones that are caused by cystine, so you require high fluid intake, sodium restriction, try to restrict too much sodium in the diet, then potassium citrate and some thiol binding agents like thiopronin. So even the surgical interventions are also similar to the ones we talked about in nephrolithiasis. So there's that extracorporeal shockwave lithotripsy, which is ideal for proximal urethra stones less than 20 millimeters. Then urethroscopy with laser lithotripsy, which is preferred for mild or distal urethra stones and stones that are resistant to extracorporeal lithotripsy. Then there's also something called urethral stent placement, which temporarily relieves the obstruction if the surgery is to be delayed or has to be delayed. Then we also have percutaneous nephrolithotomy, which is rarely used for urethral stones, but is an option in like complex scenarios. So this is also used in nephrolithiasis too, and it's also rare, so it's also preserved for like complicated cases. So for other populations like pregnant women, children, so in pregnancy we diagnose using ultrasound, like it should be limited to ultrasound, and then using conservative treatment, same thing in nephrolithiasis, using acetaminophen and hydration. Then doing uteroscopy only in the second trimester, which is the safe period for this intervention to be done if it is required. Then children, we always have to assess for other metabolic disorders and adjust their medication based on weight, and their fluid recommendations also based on weight. And then encourage long-term preventive strategies when it comes to children. And then for the prevention of this urethral to pronounce this condition is very complicated, Urethrolithiasis. So for the prevention, we have to ensure we always stay hydrated, like encourage fluid intake of at least 2.5 liters daily. Then reduce dietary sodium and oxalate intake. So our diet is very important, and then maintain adequate dietary calcium, but we should avoid supplements unless it's medically necessary, like if we have maybe we have a problem with our joints or with our bones, that is when we can take these calcium supplements. But just taking it for the fun of just taking it is not really advisable or necessary. So we should also limit animal protein and sugar sweetened beverages. And then For the prognosis of this urethrolithiasis, the prognosis is excellent with early detection and appropriate management. So most conditions, with when they are detected very early, it's easier to come back to treat them, and for the patient to the patient has a higher chance of survival than when it gets to the most complicated stage, where a lot of interventions have to be done. So about 70 to 80% of urethral stones, which are less than 5 millimeters, they pass spontaneously on their own without even needing treatment. And then most of the time, stones that are greater than 10 millimeters, they actually require surgical removal. And recurrent episodes, they are more common, up to 50% of patients, and they usually reoccur within 5 years. So long-term prevention is key to reduce the recurrence and preserve the renal function. So if we stay hydrated, we watch our diet, all these urethrolithiasis, cholelithiasis, nephrolithiasis is not really something that just occurs out of the most of the time. It has to do with our lifestyle choices, what we put into our body. So we always have to watch what we put into our body and how we take care of our body. So to end this lithiasis topic, I would just say we should try to stay hydrated always, and we should always maintain a balanced diet, not a diet where there's one thing that is always present in abundance compared to the others. So thank you for watching this video. Bye.